Okay, the very last thing we're going to talk about is how we treat for shock. Treating for shock is simple. There is no waiver from this. For your testing purposes, for everything, real life, the whole deal, there are 3 things we do, and there is no wavering from them. The very first thing we do is give oxygen. We have shock. Shock is hypoperfusion. We are not perfusing because of pump failure, pipe failure, fluid failure. So we want to give oxygen. We want to get 15 liters high flow O2 if they're between, 12 and 20, 8 and 24. If they're less than 8, we know we're going to bag them with 15 liters oxygen. If they're more than 24, we know we're going to bag them with 15 liters oxygen. So the first thing is oxygen. Okay, the second thing we're going to do is we're going to cover them up and keep them warm. So lay them down is the third thing. Supine, flat, on their back. No elevating the feet, no lowering the head, no Trendelenburg. Trendelenburg does not exist for you guys. We're laying them supine, flat. Cover them up and keep them warm, and give them oxygen. Those 3 things are done every single time you treat for shock. You do all 3. All 3 every single time. Don't waver from that. When we're doing those vital checks, we know that we do 5 minutes for unstable, 15 minutes for stable. But when you have a serious mechanism of injury or you have any signs and symptoms of shock, you need to do them even more frequently than that. Your testing is 5 minutes, but in real life, you need to do them more. Maybe you can catch that patient going into shock. They might be in compensated shock and their vitals are, 120/80 with a heart rate of 100. And you do a blood pressure again 2 minutes later and you see it declining and that heart rate elevating, your brain should automatically say, hey, I have a feeling we're cruising for decompensated shock. And if you do them again 2 minutes later and we've decreased even more, you already know, hey, I'm treating for shock. I'm putting them on 15 liters oxygen with the appropriate delivery method. I'm covering them up, keeping them warm, and I'm going to make sure that they're laying supine. So you're going to do all 3 of those things every time you treat for shock.